Hi, and welcome to another edition of the Trustcast Show. And we're really happy to have with us Emmy Sanders. Emmy, welcome to the show.
Hey, Zane, thanks so much for having me. I'm completely honored.
So today's guest spent 30 years as a dental hygienist before becoming one of the most sought after hygiene coaches in the country. And her central claim is that dentists are leaving serious money on the table every single day inside their own practice. Emmy, you said hygiene departments are running at half their potential. Where did that come from? Was there a practice you walked into that made you realize how widespread this problem was?
Well, the good news is, it is something that I have seen often. So let's start with what every practice has in common. We all have greater potential than we choose to exercise. So, what I discovered is when I started working with these teams, because the dentist is most likely the owner of the
Mhm.
practice and the hygienist is an employee, they have not been given the permission to really step into their role as healthcare providers and actually co-diagnose. So that's what's got to happen in order for us to really serve our patients to the best of our abilities and really get everything out there in front of the patients so that they
What does
can
that
make the
look
best
like?
choices for their health.
What does
Well, we
that look
want to
like,
be
a
able
co-diagnosis?
to co-diagnosis. So basically, think about it. You've been to the dentist. How long have you been sitting there with your hygienist? You're typically with them the majority of the appointment, right?
Right, yeah,
A
absolutely.
lot of dentists don't give us permission to actually talk to patients about what we see, about recommendations that we have for them. Instead, we do the work, we collect all that data, and then the dentist begins to have those conversations. What we know works best is when I'm having that one on one conversation with you, chairside. I can actually begin planting the seed so that when the dentist comes in, he says, yeah, I see exactly what you're talking about, Emmy. That tooth is fractured, and the best scenario for it would be a buildup in crown. So, co diagnosing, working together to better serve the patient. And remember this, Zane, it comes down to this simple principle. If you can get all three parts aligned, so if it's good for the patient, good for the provider, and good for the practice, it's probably okay to do.
So you walked into the average, if you walked into the average dental practice today, what would you see in the hygiene department that would immediately tell you it was underperforming?
Oh, okay. Well, one of my very first clues is perio percentage. Now, I don't know if you know this, Zane, but 50% of the adult population has some form of periodontal disease. And if that's true, then at least a third or 30 to 35% of the services that hygienists offer our patients should be perio related services, right? Well, that's not typically what we find. When I begin working with teams, I find that their perio percentage, that's the amount of perio patients that they're actually taking great care of in their practice, is usually from 0 to 5%, maybe even 10%. The minimum you want is 30 to 35%. So that's one of the very first things I look at.
So,
Another
so tell
thing
me
that I
what
look
I want to dig into that a little bit. So tell me what that looks like, the perio part. So I don't know, spit from Shinola. That was spit, not the other word. I don't know what that means. So explain to me what that means and what a hygienist can do to help in that, to make that, to turn that into something that's a win for the patient and for the dentist.
Okay, so great question. Here's what we know for sure. There's only three things that a patient is going to have when they present in my chair today. They're going to either have healthy mouth, gingivitis, or periodontal disease. Depending on which one of those that they have will determine what code that I use to tell their insurance company or to document in our business records how we served that patient that day. Depending on that, that's how I can determine if they have a high perio percentage. Because if you're not billing out the periodontal codes, then that way I know you don't have a high perio percentage. And here's what I typically find. What I typically find is that hygienists want to do a really great job at taking great care of their patients, and they have these long term relationships
Hmm.
with their patients. And maybe they have a little bit of fear about telling, "Hey, Zane, I've seen you for so long," and telling them that they actually have an active infection today that needs something more than a healthy prophy. And so they just end up billing out the healthy prophy instead. And they make great documentation that they're going to re-examine at the next visit. The reality is we have to bill for what we do and do what we bill. And when we can tap into that and really serve the patients at the best level, it fits the trifecta, right? It's good for the patients, good for the provider, and good for the practice.
So, how much production are we actually talking about? What does a dentist practice typically leave on the table per year from an underutilized hygiene team?
Oh, it typically, so if you invest in coaching, typically you can see a 4 to 5%, 4 to 5 time return on your investment in as quick as 3 to 6 months. So we're talking thousands of dollars left on the table. And here's another thing. We didn't even talk about this yet. We didn't talk about the schedule. So there's a philosophy that we know for sure. There are so many patients that one hygienist who, assuming works 4 days a week, 8 hours a day, can take care of this many amount of patients.
Mhm.
And if you have more patients than that, or if you have less patients than that, your schedule is going to reflect that. So if you have a lot of openings on the schedule, then you don't have enough patients to serve. If you have a tight schedule where you can't get an appointment with your hygienist, then you have more patients than you can serve, and you really need to invest in having another hygienist on your team. So there's lots of great ways to look for ways of picking the money up off the table, if you know what I mean.
Mhm. So, most dentists think their hygiene schedule is full. Why is a full schedule not the same as a productive one? What's the difference between a full schedule and a productive schedule?
Oh, that's a great question. You can have a full schedule doing a lot of prophies and exams. But a productive schedule is again where we give our hygienist permission to begin talking about other services that we can offer the patient. It can be as anything from power whitening to actually treating their active infection, periodontal disease. There are lots of other services that we can utilize and not have to actually add more patients into the schedule.
So, tell me a story about a specific dentist that you went in and helped them and the result. Because people always like that, that it's nice to talk through all the theories and everything, but I'm sure when you do the talks, you always tell stories because that's the most success. That's the easiest way for somebody to understand what you're talking about. So, tell me a story about a specific dentist where you had an impact on their practice.
Let me tell you about a dentist in the South, in Georgia. I'll give you that. In the South, and he purchased a practice where the hygienists were well overpaid, but not producing. He loved the hygienist, wanted to keep the hygienist. So when I came in to do coaching, here's what we did: we did a staggered approach of elevating the services that they're providing to the patients. And as we elevated those services, we were able to actually decrease that hourly fee that the hygienists were making. And the end result was, with the bonus plan that we implemented 3 months in, the hygienists were making more money at the end. And the doctor was extremely happy. You know why? Because he's making more money too. But here's the most important thing: the patients were really being taken care of to their greatest opportunities.
So, what's the number one thing hygienists are routinely doing in the chair that is clinically acceptable, but a missed opportunity for the patient in the practice?
Clinically acceptable, but a missed opportunity for the patient. I'm going to say is to not tell the patients what we see. And a lot of times that relationship, so I'm all about collaboration and co-diagnosis and getting everybody on the team focused on the same thing. But if we don't give our teammates permission to really step into their role as healthcare providers so that they can begin to speak to the patient and tell the patient what they see, that's the missed opportunity, is when we're not telling the patient everything that we see.
So, hygiene's supposed to be a place where restorative treatment gets diagnosed. Why does so much of that diagnosed treatment never get scheduled?
I'm gonna I'm gonna say patients don't schedule for 3 reasons. It's either time, fear, or money. What it really comes down is communication. If you have communicated effectively with your patient and built that layer of trust, they are going to schedule their appointment. We've got to be able to overcome those 3 hurdles that they're gonna offer: time, fear, or money. And there's lots of great ways to overcome all of those. Time is probably the hardest one because, everybody's a little bit busy in their schedules these days.
So, when you talk to dentists about hygiene production, what's the number they should actually be benchmarking against?
Oh, that's great. So, for period percentage, they need to be 30 to 35%. Compensation, let's talk about that. Hygienist compensation, total compensation package. So that's vacation, everything, all the bells and whistles. A hygienist needs to be producing 3 times more than that. If they're not producing 3 times more than that, there's missed opportunities there. So those are just a couple of benchmarks. And then open time, that's the amount of time that you have open on your hygiene schedule. You definitely don't want that. There's a sweet spot. You want it to be about 8 to 10% open time. It doesn't need to be 0 open time, means there's not an appointment anywhere on your schedule. That's a farce. That's not a true statement. You want it to be 8 to 10%. So those are just a couple of benchmarks that we use to track success.
So, when a dentist hears us talking here and they're listening to this and they say, "Yeah, but my hygienist is great. We don't have that problem." What would you say to that?
Well, first of all, I'm going to say don't believe you don't have a problem just off the way you think your office feels day to day in your routine. Instead, have someone tap in, run those numbers, c- understand what each number means, because I've never met a dental practice that didn't have some problems. So that's the start. Get someone trusted. I'm happy to help. Give me a call if you need support with that. But get someone who you trust to help you understand all your analytics so that you know what you need to focus on first. Because everybody's going to have lots of things to focus on, but you need to prioritize what's the most important.
So, hang on just a second. I have to stop because I had an urgent. So, you work with teams across the country. What does a hygienist who's truly activated for the practice look and sound like compared to one who's just punching in?
Oh, that's a great question. So, someone who is really a part of the practice is aligned with the doctor and their fellow colleagues, where they're all focused on the best outcomes for the patients. That's hard to do without giving the appropriate space for teams to really come together to create that. That's why one of the reasons why I dove into my book, Welcome to Work: Inspiring Positive Change in the Workplace. It's all about how do we get teams to work together, and it's any team. It's not just the dental team now. It could be a hair salon, it could be an attorney's office, it could be a restaurant. It doesn't matter. This What I have found is when you apply these principles, you're going to get an inspired team that works together in all positions of the business.
So, show me your book.
It's Welcome to Work: Inspiring Positive Change in the Workplace. I have some trademark things. I'll share with you one of them. There's 3 total. Agree Pact. So Agree Pact is where everyone on the team agrees the direction that they're going, and not only where they're going, but how they're going to get there, and bonus material, how they're going to work together with each other in order to get there. Because inevitably, we are going to let each other down because we're humans, right? We do that.
Right.
How do we manage that when a team member gets off track, or what I call the agree shift? That means we are shifting into a whole nother direction. But so team teams working together to have their agreed pact, it's the critical first step that I do with all teams across the country.
And what was the third one? You said a couple, or was that it? The
Well, I have a agree drift, agree shift, and agree pack. But agree pack is the most important, crucial one. And if you want to know more about that, you can get my book. It's right there on Amazon. It's very simple to get. Um, and I love it because I have found in the 20 years I've been coaching teams that it works, and it works every time.
So one of your core messages is that hygienists need to see themselves as healthcare providers, not just
Mhm.
cleaners. Why is that
That's right.
mind shift so hard for hygienists to make, or even for dentists to make about their hygienists?
You know, that's a tough question. I have a couple theories around that answer. I wonder if it's because we are not our own business owners. We are employees. If from There's a handful of states where you can be your own dental hygiene practice, but I wonder if we've not really been given permission to step into our role as healthcare providers. I think sometimes we run across what a lot of team members run across is the lack of time to learn or to implement something new or different, and kind of how to overcome that obstacle. So, if you want to step into your role as a healthcare provider, maybe you want to start taking blood pressure on all your patients, or maybe you want to do a comprehensive oral cancer evaluation on every patient, every visit, every time, but you don't know how to implement that. You don't know how to begin to do that without getting rushed, getting behind, or feeling frustrated. And what happens when we get frustrated? We got all done. I'm going to go back to the easy way. So that's what I do. I coach teams on how to do it so that you can implement it and keep it consistently.
So, as part of the what you coach about is, I mean, it's not always about the compensation, but it is kind of it's a way to measure things, and
Mhm.
to put people into the picture as a semi ownership position where they feel like they have some control over what they make. I mean, as an owner, you do have control over what you make to a certain degree by what you do, but when you're an employee, usually you don't. It's like, somebody else is going to decide, what you're going to get paid. Is part of your training structuring compensation packages so that they can take
I
on
do.
the feel of an owner?
I do some extensive compensation package workings. Not every practice is going to be the same. Not every philosophy is the same. Some is an hourly, some is based on collection, some is there are lots of different avenues. But yeah, working on the compensation package. But here's the deal: it's got to feel good for both providers, and it can't be all about the money. It's
Mhm.
gotta be about the patients. The money is just the benchmark. It shows how well we're taking great care of our patients.
Right. So what happens if you have a toxic dental hygienist? Well, first of all,
Mm.
you may or may not know that your hygienist is toxic. You probably do, but they may be toxic to your practice without you recognizing it. So how do you first recognize that, and how do you fix it, or can you fix it, or take whatever action you need to take to correct that?
Yeah, that's a great question, and I it's a gift that I have. I can walk into a dental practice, and you probably have done it too. Let let's play it out, Zane. Have you ever walked into, let's say, a fast food restaurant? And you can just tell that the people back there, the one taking the order, the one working the drive-through, the one flipping the burgers, the one doing the fries, can't you feel when they're working well together?
Yeah.
You can also feel when they're not working well together. Same thing happens in a dental practice. Same things happens at a hair salon or at a restaurant. It Anybody, any team, you're going to have that same feel. Sometimes I notice that those teams are working in that environment so often that the leader or the owner doesn't recognize they have a toxic employee. And when you bring light to it, it exposes itself. So in our workshops, kind of one of the very first things that I do is give the space to, let's talk about how are we going to work together as a team moving forward? How are we going to do all these things? Inevitably, that's when it shows up. And here's the deal. I don't coach doctors or owners to let people go. No. I coach doctors and owners to tell their team that, hey, this is the direction that I want to move my practice in, or I want to move our team in, and I want you to all be on board and all be a part of it. These are the expectations. This is going to be the groundwork. This is how we're going to measure our success. And when you say it like that, you're laying down the opportunity for each employee to make a commitment. They're either going to commit or they're not. And you're giving it's because we're all at choice, right? So you're giving them a choice to decide. You don't have to let toxic employees go. When you change the way you want to run your business and offer them the opportunity to get on board or not, it's their choice. And inevitably, those toxic people who don't want to change, they inevitably leave on their own.
Right. So, let me do some rapid fire, just kind of break things up. One word that describes your coaching style.
Energetic.
What do you do outside dentistry to stay sane?
Ooh, I like to fly fish.
Oh, really?
I do.
Interesting. Uh, so most fly fishermen that I know don't ever keep their fish.
No,
You throw them back to
no,
them?
it's yes.
I don't know why,
It's
what it is. I do regular fishing. I keep my fish, but fly fishermen don't. So
no.
I don't know. It's a code of conduct or something. Biggest mistake you see dentists make in the first 6 months after hiring a new hygienist.
Biggest mistake that dentists make, um, probably not creating that, alignment, not getting on the same page and clearly, so what a dentist learns and what a hygienist learns, they may be different, and you get to find a way to weave those two knowledges together. And if you don't take that opportunity to do that early on in a relationship, you run the risk that that relationship doesn't last as long as you'd hoped.
So, underrated skill every hygienist should develop that most dental schools never teach.
Communication. And for dental hygienists, I'm gonna say business. It's a business acumen of how a dental practice works and what the overheads are. I mean, gosh, they didn't teach us that in school. And communication, how to talk to patients, how to overcome patients' obstacles, how to tee up treatment for a doctor. So, a couple of things there.
So, you've written about financial conversations being a clinical responsibility. What do you mean by that? And how does it change how the hygienist appointment runs?
So financial conversation again, patients are not going to schedule the treatment that they deserve to have for one of three reasons: time, fear, or money. And a lot of it's money. And if you can have that conversation regarding the money, helping the patient find ways to make it fit within their budget, it's the better outcome. Remember, it's good for the patient, it's good for the practice, and it's good for the provider. So, understanding that communication of how do we discuss finances with patients in a loving, open, and trusting way to help guide them to make the best decisions for themselves.
So, walk me through what a high performing hygiene appointment looks like from start to finish. What actually happening that most practices skip?
I'm gonna say utilizing the whole time. So most hygiene appointments are approximately an hour long, but utilizing the whole 60 minutes. We sometimes have in dental practices televisions on the screen. There should not be televisions on the screen. That should be dental related information for the patients. Also talking about, vacations and things like that with our patients. Yes, we wanna have a relationship with our patients. We wanna know them as individuals, but maximizing the total 60 minutes of the appointment, because that's essentially what they're there for, is your expertise. And we don't always, utilize all of that to really serve the patients and tell them everything that they need to know in order to make the best health decisions on their behalf.
So, talk me through a typical dental office that implements your coaching. Eh, you'd said 4 to 5x on the investment.
Mhm.
Um, so, how soon does that and so in my first year, let's talk about never mind the investment. As a practice, let's say I'm a solo practitioner with how many hygienists are typically in a solo practitioner? Uh,
I'm gonna say if I had to pick one number, I would say 2
so so
solo.
walk me through what solo practitioner with two hygienists could could typically expect from a return. I mean, there's no guarantees, but what have you seen historically from implementing, a more broader or giving your hygienist a greater degree of latitude in practice?
Well, I'm gonna say that it's kinda hard to answer it without knowing every dental practice has its own, opportunities for
Right.
enhancement, and depending on the opportunities that are there, here's what I do know. I have teams that invest with me, and depending on what they want or want to focus on, that could be a 30 to $50,000 investment. And typically 3 to 4, I have had 6 times, return on their investment, and within they see it right away. 3 to 6 months, they can see that investment come right back to them. And it's because we look at the total thing. I look at the fee structure. What are the fees in your zip code? What are the other dental practices billing for those same services in your zip code? You don't want to be the most expensive person in town, but you don't want to be the cheapest either. And
Right.
here's the shocking thing. I usually see that people are in the 40th to 50th percentile. They're nowhere up near the 80th or 90th percentile where you really should be.
How do you
So
know that?
depending uh, there's a national database that keeps all of the zip codes of the fees for everything that's billed out.
Do most dentists know about that?
I don't know. I would say a lot do, yes. I don't know that everybody knows that or knows how to access that. That's what consultants do. But yeah.
So typically, when you send in, or someone says, "Okay, I think that this sounds like a great idea. I want to implement this coaching program," um, and then it's called. So what's the name of your coaching program called?
Well, it's all custom coaching. So you can find me at Emmy Sanders RDH. That's my website. We'll add it here in the show notes if you want a quick link. And I don't have a cookie cutter coaching program.
Yep.
Instead, I meet and hear what it is you're looking for and customize. So every coaching program is customized to the team.
So give me an idea of what of how that might work. So if I say, okay, I feel like I'm not using my hygienist, my billing's not quite right. I really want to look at everything in my practice. How would your program fit into that?
So first things first, if let's say you wanted to engage and just have a conversation with me, schedule a 30-minute conversation with me on Calendly and let's just chat. If we are in alignment, that's got to be first thing, right? First things first. We have to be in alignment. If we are in alignment, then we can move forward with you share some of your data. I will build a report for you that tells you some opportunities that I see. What would you like to work on? Take into account all the things that you know that are wrong in your practice and need to be addressed, but some little things that I will almost always uncover a couple of things that, hey, did you think about this? And could we do this? And working through that together, once you agree, yes, that's what you want to do, then I work with your team. I do team questionnaires. I do lots of data collection on the front end, and then we do a workshop day. And the first thing we work on is, I bet you know the answer, the agree pack, because it's got to be the fundamental piece of how we're going to work together and how we're going to implement this change.
Yeah.
I hope I said that well enough for you, Zane.
No, that was good. Um, so you coach practices from single doctor boutique offices to multi-location operations. What's different about fixing a practice that's just one single location versus multi-level? How do you manage that? I mean, I know it's totally different, but tell me about how that works.
The fundamentals are the same because we're just working with people. The fundamentals are the same. Where it gets tricky is the multi-location, a little bit more legwork on the front end, a lot more tracking on the back end. But it's all the same. It's people, and people really, we are not all that different. We're more alike than we are different.
So, what does the dentist who's truly unlocked their hygiene department look like 6 months after you work with them?
Mm, I'm gonna say they are happier team. The culture feels on point. They have uh, had some major breakthroughs with some benchmarks that they're beginning to work on, and they have discovered some other opportunities that they too would like to begin to address.
So, what does Emmy Sanders RDH look like 5 years from now?
5 years from now, probably the same thing. I love what I do. I'm not going anywhere anytime soon. Anytime that there's a team in the country that wants help, I want to be the one that can help them.
Well, thanks so much for coming on the program, Emmy. I really appreciate it.
Thank you. I appreciate you too, Zane.